Welcome, Tammie. Thank you for making this presentation for our video series. Tammie is a highly skilled nurse anesthetist and nurse practitioner based in Florida. She currently serves as the medical lead for Studio Bahia, where she is committed to the development of virtual reality therapies, education, and research for underserved populations across the globe. Tammie's research interests focus on the use of virtual reality to alleviate procedural pain and anxiety, with a particular emphasis on understanding the patient's experience within the virtual environment.
We develop virtual reality therapies, education, and training for underserved populations worldwide. We also develop the virtual reality environments for researchers and for universities so that they can do their research studies. We've also developed Lily VR, and I'll talk a little bit more about that later in my talk. So how did I get into learning about virtual reality? I wanted to provide pain relief for my patients, and you're looking at providing opioid-free or opioid-sparing techniques to our patients. And so I started reading about virtual reality because everybody nowadays has their phone in front of them. Even the patients, in the waiting room are on their phone. So I was like, there's got to be something with this that we can use. And so I was reading about Snow World, and that's the very first virtual reality world that was designed to reduce pain in these patients with burns. And when I'm reading these studies, I'm reading about how children were actually looking forward to their next dressing change, which fun and dressing change for burn wounds just should not be in the same sentence. But here they were able to do that. They were actually able to improve outcomes and have these children actually looking forward to their dressing changes. And so I was like, I want to offer that to my patients. And so how does virtual reality work? I just want to share just briefly about virtual reality and how it works. We think that the brain has really a limited supply of resources. And so virtual reality is very immersive. It incorporates sound, vision, different emotional responses, and then the brain just attenuates what it doesn't want to pay attention to. So that painful stimuli just becomes more of a nagging sensation in the background. And functional MRI does show that there is a reduction in pain-related brain activity when we use virtual reality as compared to with control. So we actually are seeing a difference in the activity of the brain when patients are using virtual reality. So how are we using this virtual reality? I'm going to be more focused on the actual utilization of virtual reality in direct patient care. Lots of different ways we can use it in healthcare, but because I'm more of the actual provider of healthcare, I wanted to talk to you about the direct patient usage. And so when we look from the very beginning in the emergency room, just kind of go over a few studies, just to kind of give you an overview as to what we're seeing out there. But in the emergency room, they had patients use virtual reality 3 to 5 minutes at a time. They saw a decrease in pain, anxiety, and anger levels. And if you've ever been in the ER, you know those patients. They're really quite anxious. Why haven't I been seen yet? They're worried about what's going on. And we've been able to use virtual reality to help attenuate that. And what's really interesting is that the patients who actually have higher levels of health and higher quality of life actually had the biggest drop in anger and anxiety when using virtual reality. And they use it for approximately 20 minutes of total time while in the emergency room. We also look at hospital patients from the oncology floor, GI floor, neurological floor, just your general hospital patient, and we see decreasing pain scores. Most notably, those with the most severe pain had the greatest decrease. And this is just for using it 3 times a day, 10 minutes at a shot, and then as needed as they felt. When we look at the operating room, this really has a huge impact. Episiotomy repairs, in the United States, we often do these under an epidural. They don't feel anything, or they don't feel any pain. But this was actually a study of patients who did not have an epidural, had the episiotomy, and used virtual reality during the episiotomy. After stopping that, here's your baby, check them back in an hour. They actually found that the pain reduction continued even after virtual reality was discontinued. So you have the patient who uses virtual reality. They have noticeable decreased pain scores during the episiotomy. Stop virtual reality, and still 1 hour later, their pain scores are still lower than those who did not use virtual reality. And one thing that's really interesting in this study is that the perceived time was changed. It was decreased. It was almost half of what actually they experienced. So you have a 20-minute procedure, it feels like it took 10 minutes. And we often think about patients, especially in pain, is that they can self-catastrophize. So if it seems like it's taken forever, it kind of builds upon itself. But if we're able to, have that perception decreased, instead of being 20 minutes, it only feels like 10, then there's less of that self-catastrophizing that can occur. Another option is when we look at spinal anesthesia. And it doesn't matter if it's the hands, the feet, the knees, we can block it, whether it's a spinal or if we do a nerve block. We have a limb that is not experiencing pain. We can do surgery, and oftentimes we're using some sort of sedation for the patient. But what they're able to do is use virtual reality, and they see a decrease in hypotension. They're seeing a decrease in the oxygen requirements, but they're also seeing an increase in comfort score. And so a lot of times these patients, I had one come into me for carpal tunnel surgery, and he didn't want any anesthesia. He wanted to be able to drive himself home. He didn't want me to give him any medication. And so sometimes we do a lot of verbal anesthesia, where we just talk the patient through it. There, let's talk about your grandkids. Are you going to go fishing this weekend? How's whatever sports going on? What do you want to talk about? And we'll just talk through this. Sometimes, they just want to be left alone, but virtual reality is an option that we can offer them. So they can get numb in whatever area we're working on, and then go into the virtual reality environment. Doesn't feel like it's taking as long, and they come out more comfortable. We're also not seeing those adverse events that we get when we start giving people sedation. Talk about oxygen requirements, hypotension, but then also the risk of aspiration, the risk of needing to insert an airway, or rescuing the patient from that sedation. Post-burn rehabilitation, and this is the study that kind of got it all started for me. You get these kids, 6 to 19 years old. They have doing range of motion exercises, and there's an increase in what they call fun, and they describe these children looking forward to doing their exercises, because they're getting to go into the virtual reality environment. And you can see this one's using Snow World. And what's also really important about this study is that it shows that repeated use does not diminish the outcomes. I've had people ask me, like, hey, if I do this 3, 4, 5 times, does it become less effective? Maybe I've become accustomed to the virtual reality environment. And actually shows that that's not the case. Another important thing about this study is that there are a risk of something called cyber sickness, and I'll talk a little bit about that later. But those who experienced some cyber sickness, a little bit of nausea, that actually went away after repeated exposure. So the more times that they were in the environment, this became less and less. And that's where I showed you the Lily headsets from the beginning. It's one of the things that at Studio Bahia we're trying to get out there is the ability to send patients home with a low-cost virtual reality headset that they can use leading up to their hospitalization. So if there is a risk of having to be a little nausea, it diminishes with repeated use. Let's get you acclimated to it. Then you come into the hospital. You can have a session while you're waiting in the preoperative area, so you're not as stressed, not as scared. And then post-op day 1, we can start you on the therapy of using virtual reality. You're familiar with it. And not only that, you can go home with the same unit so that you're able to have a continuity of care. We're offering it at a low cost point to the hospital. And even if you don't use ours, I'm not wanting to do anything commercial here, but the concept that you can start this before, after and continue it at home, and the fact that the side effects that you might experience do diminish, so you have an advantage of using it before you undergo surgery if you know that you're having a pre-planned procedure. So physical therapy after surgery. This one is actually quite amazing when you think about cost of healthcare. They used virtual reality twice a day in rehab in the hospital for those who had had open heart surgery, whether it was bypass grafting or valvular heart surgery. Not only did you see the decrease in pain, but we see an increase in the walking capacity. So they did a 6-minute walk test. How far can you walk in 6 minutes? Those who use virtual reality actually were about on average 56 meters further than those who did not. We also noticed a decreased length of stay by 2.8 days, which is huge when you're thinking about being hospitalized. So these patients were ready to be discharged almost 3 days, say 2.5, 2.8 days sooner than those who did not use virtual reality. And that can really help save our healthcare costs. So wound care, burn changes in children, again, showing that this can be used in children. These studies 5 years, 6 years old, showing that it is useful in children as well. And the importance of this study really shows that you can work around the virtual reality headset to do what you need to do, and that it does not impede our being able to work with the patient. So a lot of questions I also have is, well, if I'm in this environment and I'm trying to ignore the rest of the environment, well, what if my doctor needs me to do something or surgeon needs to do something? You're still able to be cooperative and compliant with what they need. Move this arm, move that, look here, look there, whatever. You're still able to do that. You might need an extra prompt because you're distracted, but you're still able to do and be compliant, which is oftentimes a help. If you're able to raise your arm to do a dressing change for underneath it, or the leg to help position yourself to make things easier for the surgeon. And again, in children, this is really important that we can use it for venipunctures. You can put some numbing cream on, get them in the headset, and they do much better with getting that needle stick or the IV started. But the study also shows how important it is for the healthcare providers, as well as the parents, because it showed not only the children were more satisfied with their care, the parents didn't have the stress of seeing their child anxious or feel like they were being tortured by the healthcare provider, and the healthcare provider didn't had that increased satisfaction of knowing that they weren't tormenting a child. Because as a healthcare provider, it's really, really hard when we know we have to do something to make you feel better, but it hurts us when we know that it hurts you. And so this can actually improve not only the patient's satisfaction, but it can improve the satisfaction of the parents and the healthcare provider. And what's also interesting is that those with a higher level of anxiety experienced a much greater decrease in anxiety. And like those with the most pain have the most benefit, those with the most anxiety seem to have a greater amount of benefit with virtual reality. So, I'm reading this and I was like, okay, well, what do I offer? How do I do this? How do I start? And that's where I went back and reread the studies. Like, okay, well, what environments did they use? We know about Snow World. What other environments are they using out there? And there's a lot of the studies just don't say what environment they're using. They just use virtual reality. Some of them will say, I'm using a non-offensive comedy. Well, that's great. Who found it non-offensive? And how does that translate across cultures? A lot of them will say we're using a water scene because water is relaxing, and here's the beach. Everybody wants to be at the beach and relaxing, and I'll show you later how that's not necessarily the case. So thanks to Dr. Kurt Weber, who I don't know if he's here today, but he was gracious enough to allow me access to his office. And I was looking into studying the patient's reaction, their emotional response to the virtual reality environment. I'm trying to kind of pull out what are the key components and how can we make a rational decision on what environments we offer instead of just kind of hodgepodge and picking this, picking that, because that's what I like. Because what I like may not be what you want. It may not be effective for you. And that's where I came up with the patient-centric environment, putting the patient in the center and their needs and considerations as at the forefront. And when I talk about the environment, I'm really talking about the sum of the components. So you're looking at the setting. You can also consider that the scene. Where are we sending the patient? You have the energy level. How dynamic is that setting? Interactivity. At what level of interaction does the program allow for the patient? And finally, interface. How do they perceive this environment? And so the setting, that's really the base component. That's where are we going to go? Of course, all of this is computer driven, but you can have scenes that are based in reality, 360 videos, rotating photographs, and then you can have scenes that are based, that are computer generated, but based to, mimic reality to maybe more of a fantasy type environment. And finally, you can have abstract, three-dimensional environments. And one of the key components that we look at is how the sense of presence, feeling like you really are in that environment, impacts the effectiveness of the intervention. But that's not everything, because you can have a really super strong sense of presence, but not have an effective intervention. And when I mentioned that beach scenes are often one of the scenes that are listed as being included, well, in this instance, I had a 73-year-old female who was from Missouri, so middle of the country. She chose Portugal as a 360-degree video. And the initial part of the videos has Portugal in the mountains. So these mountain scenes and then the countryside scenes, and eventually we end up on the coast of Portugal. And the scene on the left comes up. And when we get there, I'm watching what she's watching. I have it cast to my computer so I can see what she's seeing, and I'm observing her. And I notice that she becomes visibly anxious. She starts to try to climb out of that chair, and she's trying to get away from something. And so I was like, "Are you okay?" She's like, "No, I can't determine where the water ends and where I begin." You talk about a sense of presence. You are in a chair, in a building, miles away from the water, and you're afraid you're going to drown. Talk about being present, but also talk about where the setting can give you an intervention that's not effective. It's not effective if they're anxious. It's not effective if we have to stop the virtual reality environment to get them through this. So I sped up the video, get back to the countryside scenes, and she does great. The next time they go back to the ocean side, we have the picture on the right. Unprepared this time. I'm like, oh, I see water, open water. How's she going to handle it? And she's calm. I'm like, are you okay? She's like, yeah. I'm like, okay. We continue on. At the end of the session, in our debriefing interview, I'm like, what happened, and what was okay about the second beach scene that you were okay? And she noted that the post let her know that the water was not going to overcome her. And you can see wet sand on one side, dry sand on the other side. No barriers between the water and her on the left side, but she had those little barriers, even though, quite honestly, any good wave could overcome what looks to be maybe a foot or two high barrier. But that was enough to let her know that she wasn't at risk of drowning. And so that's where we really need to consider what we offer and understand that not everybody's going to like the beach scenes. There are going to be people who are afraid of drowning or that these scenes cause some anxiety. But, if the programmers can consider little barriers like that, can make a difference between an effective scene and a scene that's not effective. And the next component is the energy level. How dynamic is the setting? And we really look at from low energy to high energy. Low energy kind of being the muted colors, and consider the beach. We got our setting. We're at the beach. 7 o'clock in the morning, the sun's rising. Got all the pretty colors of the sunrise, gentle breeze. The waves are coming in gently, maybe a bird or two. And then it's 3 or 4 o'clock in the afternoon. Now we got a thunderstorm, and we got the lightning, and we got the thunder, and the wind is blowing. Those palm trees are blowing over. Those waves are crashing. Those seagulls are screeching as they run, as they fly away. High energy, brightness, changing color. There's lots of movement, the sounds of the crashing and the thunder. It's still the same setting. We're still at the beach, but the dynamics have changed. And what I've noticed is that people who prefer a lower energy environment, you put them in a high energy environment, they throw those hands up. Whoa, stop it, it's too much. The colors are too psychedelic. There's too much movement. It was coming at me. But then you put someone who prefers a high energy environment into a low energy environment. They're like, is this it? Oh, this is boring. There's not enough to distract me. And so it's more than just relaxation that we're trying to accomplish. We're trying to accomplish an effective intervention. So they may feel relaxed in one environment, but remember, we're trying to block out the pain, trying to block out the anxiety, trying to block out those external stimuli. And so we need to consider there's going to be a part of the population that needs that higher energy environment to do that. And finally, interactivity, the ability to interact with the setting. Studies show that interaction with the environment improves outcomes. Some of the people that I worked with were passive observers. They were quite content to sit there and just watch it in front of them. Others kind of got into exploring. They wanted to see what was behind that rock or what was in that house or what's around the corner. Others, very much goal-oriented. They would give themselves a goal, like they tried to figure out the pattern. There was 3 reds and then 2 blues and 1 purple and then 2 yellows. And then you can have environments that offer goals, that are games, or there's something for the user to do. And when they do that, they get the reward. And that helps engage their attention into the environment. And finally, interface. Really got to consider several things when you're looking at what headset are we going to offer. Procedural requirements. If you're going to be working on the head, let's say you're doing a awake craniotomy, you need access to the back of the head, but you still want them to be in virtual reality, they do this. You can have it just, sitting there without the straps. So you got to consider that. If you're doing research and you're wanting to observe and record what is the patient seeing, what is the patient doing, what are their eye movements, you got to consider that you probably need a corded access. Or perhaps your Wi-Fi is not secure in your location. You might need corded access, so you're not relying on the hospital or the site's Wi-Fi. Then you also want to make sure that your cords and wires or whatever don't get in the way of the proceduralist or the surgeon. Headsets. You got to make sure the headset's comfortable. You have some different ethnic groups and cultures that might have different hairstyles or head dresses that you might need a larger strap to go around. Women, if we have our hair in a ponytail and you have a single strap that goes around the back, that might ride up, ride low based on the ponytail, or if their hair is in a bun, that might make it uncomfortable. So, that's it's a consideration, because you want that headset to be comfortable. You're also looking at the field of view. The wider the field of view, the higher the resolution, we've seen improved outcomes. So you want to try to offer as high of a resolution, as wide of a field of view as you're able to. And then finally, the experience. You really want it to be streamlined. You want it easy for the patient to select their environment. You want it easy for them to interact with that environment. You want to take it off and do something, put it back on, get on the computer, do something else, put it back on. You want those any type of controls to be very intuitive for the experience. And you got to consider, what are we doing? Are we going to be sitting up? Are we going to be in a beach chair position or reclining? Are we going to be laying on our back? And you got to make sure that the environment accounts for that. Because guess what? If it doesn't, you might have a beautiful scene, pick a beautiful scene sitting up, and okay, we're going to lay down. Let's do this procedure. And now they're looking at the sun. Not effective. So you got to make sure that the software that you use can adjust the horizon so that when they're reclining, the horizon's where it should be, or if you have to put them in the supine position, that the horizon is going to be where you want it to be. So safety aspects. They've done several studies looking at pediatrics, and we've seen that it has been quite safe. This was a child life intervention, so they did a retrospective review, and they had minimal amounts of anxiety. One experienced some dizziness, one experienced some nausea, and this was all over the hospital. There's lots of different areas that they're using it and have determined that it works even with children. And then with the older adults, you have some cognitive or physical impairments. Mean age of 80.5. 22 of the participants were prone to nausea and dizziness at baseline. So you're thinking, okay, those are the ones that are at risk of having cyber sickness. Didn't have any of it. And something else that's an issue with our older population is hearing aids, glasses, no issues with that. And it worked, really well that a majority of them wanted to try virtual reality again. So any questions? I kind of went through that fairly quickly.
I think you kind of answered it towards the end of your talk, but somebody had asked what kind of VR, what kind of experience would it be? And I think you really answered that, but are there anything really specific that you would use for therapy?
So this is my virtual reality headset that I used for my research study, and it's an Oculus Quest 2. And so you put it on, and when you go in there, you can choose a variety of environments or scenes that you would like to experience. And it's this three-dimensional scene that you can see, and you can hear, and you can interact and look around, side to side, up and down, all around. And it's like you're really being teleported to a different environment. So does that kind of help explain?
I think so. You mentioned that this would be good for pain control. And I'm wondering if you think insurance companies will ever cover a VR set for that purpose.
There is, it's actually FDA approved for, Applied VR has FDA approval for chronic pain. And there are billing codes that we can use for it. So I think, if you go through one of those programs that it should be, although I don't do insurance. So I couldn't tell you if it was or was not, but there are definitely billing codes for providers to use. Do you know, Kurt? I see your hand going up. And I was going to say, that's one of the reasons why Studio Bahia is offering, it's a $25 headset. And we're making any virtual reality therapies we develop free for those who perhaps don't have insurance or they can't afford the co-pays. So that's something that we're doing to help. I do know that providers, there are some billing codes. I don't know those off the top of my head. I could get those if anybody's interested. For providers who want to offer virtual reality as part of their therapy. And I would think that if you're prescribed it, because it is now FDA approved, then that would go through your insurance, although I am not an insurance specialist by any stretch of the imagination. Most of what I do is actually inpatient. And so our guidelines are different than if you were looking for outpatient procedures. So I'll go through the list that I see here. I know Kurt asked me if I have an estimated ICU savings. I know we bill Medicare
Oh, okay.
$1,500 a day for an ICU for a hospital bed.
I didn't entirely understand your slide because it sounded like the way I interpret it, and I wanted to make sure that I'm correct, is that they were people who were generally prone to dizziness or nausea, but no one experienced dizziness or nausea while doing VR. Do I have that right?
That is for that study.
For that study.
For
Okay.
that study. So those who have prone to motion sickness, migraines as well, tend to have an increased risk of what we call cyber sickness. It's not exactly motion sickness. It's a slightly different mechanism of action, but those with those two conditions tend to have an increased risk of cyber sickness. So a lot of the studies will exclude those people. But in this one study, it actually included those people and demonstrated that they didn't experience it. Another thing that can help with the cyber sickness is the positioning. When you're in that semi-recumbent beach chair recliner type position, they're less likely to experience cyber sickness, which is a lot of our procedures will be in that position. So, and then repeating use will help diminish those symptoms. It's like they almost become acclimated to it. We try to limit the time frame. In a short time frame, kind of build up from there. Usually after about 30 minutes or so is when you start to maybe increase the symptom rate. So a lot of these studies might be 5-10 minutes of usage. Some of them are longer. Obviously, if you're doing something like knee surgery, it'll be for the duration of the knee surgery. But a lot of times we'll start off 5 to 10 minutes is all that you need to actually have results. And then you're kind of bypassing that time frame for development of the cyber sickness. But with the cyber sickness, most of the time you just stop the virtual reality and it'll dissipate on its own without further intervention needed.
You talked about knee surgery and other surgeries. Do you
Mhm.
think that it will enable people to have less anesthetic and that kind of stuff to put them out during the surgery and be able to stay awake through it?
Absolutely, and it's one of those things if they want it. There are people who come in and see me and they're like, I don't want to know a thing. I don't want to hear a thing. I don't want to be aware of anything. And I'll certainly respect that. There's another on the flip coin, a lot of people who are more afraid of the anesthesia than they are the procedure. And they're like, yeah, they've researched their surgeon. They're comfortable with whoever that person may be, but they don't research their anesthesia provider. And so they're afraid of the anesthesia. They're more afraid of what I'm going to give them drug-wise. So if I can do some sort of nerve block or a spinal, be like, okay, you're not going to feel pain, or if you do, we can still intervene. And that's a good thing about virtual reality is we can start with virtual reality, and if you're like, yeah, this isn't really for me, no problem. I can get you off to sleep. So that's always, always an option. But hopefully, if we can decrease the anesthetics, we decrease the recovery time. I like that gentleman that had his carpal tunnel. He was able to drive himself home. He didn't need to have a family member or somebody accountable for him. He didn't have anybody. And so that's part of the reason why he didn't want to have any medication from us, is he knew we could take care of the pain. He just didn't want to have to worry about trying to find a ride home.
What can you tell us about, or can you give us resources
I'll see you, Ken.
where we
Oh, sorry, Ken was raising his hand. I just was letting him know I saw him. That's okay.
Okay, just kind of follow up to what you were just saying about the carpal tunnel patient. I'm in a similar situation. I don't have people that I could just call up, hey, come on and get me. You have to sit there for 3 hours, though. I don't have anyone in town who I'd feel comfortable asking something like that. How would one approach a provider who insists that they're not going to do the procedure unless I bring someone with me?
Ask them more. I mean, if it's a procedure where you can't drive, let's say a knee surgery, where you're physically unable to press the pedals, sure. But I would, if you're going to have it in a surgery center or in the hospital, usually somebody from anesthesia will try to reach you to kind of review the data before you ever come in. You can talk with them. or call the center that you're going to be going to and ask to talk to an anesthesia provider, a couple of days before your procedure. The surgeon doesn't get to pick your anesthesia. It's the anesthesia provider that should be choosing your anesthesia with you.
I'm thinking specifically for things where they put you under twilight, whatever that is, for some dentistry or I'm due for a colonoscopy.
I can answer this one directly because I went through this in the past few months.
Without having to go under so that I can get myself home.
There are alternatives. There are some doctors who will do it without anesthesia, but it's not highly recommended. I've talked to several between places my dad and I both went and shopping for other, where do we go? So some will do it without anesthesia. Not everybody will for a colonoscopy. And depending on the medical center, some of them have connections with hotels. So you can legally take the hotel shuttle from the medical center to your hotel, and that way you bypass a driver, and that way you get home. Because legally, things like Uber and taxis can't take you if you're by yourself. They can take you if you have somebody else babysitting you afterwards in the vehicle.
Oh, really?
But definitely talk with your healthcare provider in that case, like a colonoscopy. You just have to find a GI doctor that's willing to do it.
And it's more you need to talk to their staff because the doctors themselves don't always know the answers to it. I had to go through a bunch of different ones. I'm an only child of an only child with a visually impaired father, and also not having a lot of backup driver abilities to call people. So it really depends on the office staff as to who's willing to do it.
But definitely don't be afraid to ask for it. I was a GI nurse practitioner for years, so I wasn't the one doing obviously the procedures, but scheduling them, and I would have patients ask me. And so I would know within my group, and 6 different GI physicians, I would know which ones were willing to do it. And I would we're going to steer you over here and I'm going to have you talk with Dr. So-and-so because I knew that he was willing to do it.
Basically shop around.
Huh?
Yes.
Yeah, shop around.
So I had my hand up for quite a while. And I have a variety of questions, but I guess the one in particular I'll go ahead and ask is, it sounds like you're assigning the visual reality content to people. Do you allow any type of choice whatsoever, or is it strictly assigned?
No, this is the whole idea, is that we want to offer choice. We want to have choices available. And how do we make the rational decision as to what should we offer? With understanding that people are going to want some people are going to need a high energy environment, some people are going to need a low energy environment, and understanding that some people are going to want more interactivity than others. This is what's available. I kind of go through with them, what's available. But what I noticed when I did my research is that people I had one that actually took 5 times to find the correct environment. And so sometimes, and that's what my future research is going to be going into, is how do we predict what's the best environment? Because patients don't always know. They think that relaxing beach scene looks good. They like to have a drink at the beach. Who doesn't? And then they hear the machinery and they're like, oh, this isn't enough. So having a lot of options available, allowing them to be able to choose and say, that's not it, I want to go into something different. And that's where streamlining the process within the virtual reality environment so that they can say, nope, not that one, next. And they can do that without having to talk to anyone or interrupt the procedure, that they can just do that themselves. So I'm trying to encourage having a variety of options available.
Do you couple this with other things? Like my dentist and orthodontist both have dogs in their offices.
Mm-hmm. Well, I can't have dogs in the OR. I wish I could. I'd be the first one to have a dog in my OR. But absolutely, nothing is by itself. When I decide an anesthesia plan for someone, there's lots of things that go into it. So could virtual reality be the only thing? Sure. But then you got to tailor it to the actual individual. So there's no one size fits all. But it's actually more effective in that, well, dogs are great. Some people are allergic. Music, great. You can still see what's going on because you still have the visual feel. So you can do music with a virtual reality. You no longer see, what the surgeon's doing or what the assistants are doing.
And I
And it's
think,
also something that surprisingly not a lot of the healthcare providers know about. When I first started doing this, when I talked to my colleagues, a large majority of them had never heard of it. And so we're trying to get it out there that, so we have actually developed, not me, but in the anesthesia field, a game for children who are undergoing general anesthesia on smoothing out the induction. So they tend to be more, game related, but I don't really deal with a whole lot of kids. I'm near Sarasota, Florida. I'm in old person land. 30 years old patients young for me.
Yeah, hi Tammy and Emily. I am a nurse informaticist by way of the OR, I love VR, so I have quite a few questions.
Okay.
My first one is when you were talking about doing, I've been in awake craniotomies, so are you like using like a Mayfield head horseshoe to hold the piece on? Because if you can't use the headset straps, you'd have to be doing like an occipital kind of.
We're actually developing it right now, where it actually attaches to the side rail.
Mm-hmm.
Some of the surgeons we're working with have actually gone away from using the your headpiece and are actually just doing it
Mayfield?
on a donut pill. Yeah, they're just doing it on a donut.
Yeah,
pill.
yeah, I'm aware of the donut. Gotcha.
Yeah. So some of them are, still using, the head device. Some of them are just using the donut, but actually looking at attaching it to the handrail. So we have a prototype developed that we're using. We're looking to actually get this into hopefully production, where how the OR bed has that long rail.
Yeah,
attached
the rail,
there.
to clamp everything onto.
Yep. And using that so that way it moves with the head and can use, if the bed goes up, it goes up and moves with the patient. So not using any straps whatsoever, to just have it sitting on the head.
Okay, cool. What is it? My next question is the Lily VR headsets. That is something that you said it was $25. So that's something that you insert a mobile device into. Is that?
Yes.
Okay.
Yes.
Okay. That answers that question. Considerations with the
lightweight, yeah.
Considerations with the pediatric patient. I mean, there have been warnings for children not to be using VR because of, small intrapupillary distance and stuff like that. I mean, are there any concerns regarding safety? Because they're saying, oh, you have to be ages 13 up to use the popular branded headsets that are available.
Yeah, and we have studies that go down to 5.
Oh, okay, cool.
That show that it is safe and without any adverse reactions, as low as 5. And some of the even the younger children are actually using projections onto the ceiling for the hydrotherapy. And that's been shown to be effective even younger.
Oh, cool.
Because that's not directly on their head, but they're looking up, in the hydro tanks into the ceilings.
Okay, cool. And let me see. I think I probably will email you because I've got a ton more questions. But my last question is, my hospital, we utilize a virtual reality headset in our chemotherapy department. It's a trip through our metro parks for the 1 to 3 hour duration of, in chemotherapy infusion. Yeah, and I do want to get more involved in this because it's where my interest would meet, because I'm a nurse informaticist. It's just that worlds kind of collide. I'm probably going to be emailing you. So.
No, that sounds great. I would love to. Yes, absolutely.
Yeah, cool. Maybe we can talk offline. Thank you.
Okay, Joan, you've had your hand up for a while.
Sorry, I couldn't figure out how to raise my hand. I just low tech orientation. It occurs to me that this can be used perhaps not in medical settings for medical reasons. For example, meditation, productivity, urge resistance, i.e. alcoholism, gambling, sex addiction, binge eating, blah, blah, blah. How do we find out more about that?
So SPIT is, I talked about SPIT-C, S-P-I-T-C. They're the consortium of researchers in mental health. And from, because I didn't even dive into the mental health perspectives of phobias and cigarette smoking, sensation, diets, ADHD, behavioral disorders. I have a colleague and friend who's working with children and playing games and teaching them, modeling behaviors for them of how to win and how to lose. And these are things that, they're not being taught at home or in the school. They have through them, there is a link, a Word document, Google document that has the contact information of everybody who's made themselves available to be contacted. And so that might be a good place to kind of start to get names and email addresses and what do they do, through that Google document on SPITS.
Also, John, as far as meditation and like diet, health stuff, there are several commercial companies that are trying to market stuff like that.
I'm sure there are. I mean, I'm not the first one who saw
Yeah.
it. Yeah, but you don't know which one specifically off the top of your...
There are several, and I would, just search on the web because different people recommend different ones. I've tried a couple, but I'm really not into meditation. I just like, why am I looking at this beach? And then there's other ones that'll like take you through a fantasy tunnel with lights going. So
Yeah, and Trip is one that I've used personally that has a lot of different options, and you can kind of adjust it to what you might be looking for. Do you want them to talk? Do you not want them to talk? Do you want a male voice? Do you want a female voice? How long do you want it to be? Do you want more focus on being focused or relaxation? And that is one of the ones out there, but there's a lot of them out there. And then I put a link up. This is not exactly Spitzy, but it'll get you to the group at Stanford that does the research. If you're looking for anything more to dive into the other types of addictions and mental health that they're using, they're also doing like a lot of taking people through shopping, people who maybe are afraid of shopping, getting them to go to a store in the virtual environment to kind of help, get them ready for this in the real world. So they're doing lots of different things like that.
Also, productivity, procrastination, stuff like that, which is not necessarily always mediated or treated in a medical setting. It may be.
All right, let me, yeah, I can't hear you now, but let me ask my question. Have you tried, instead of these nice pastoral scenes that you've been offering, just piping through a heavy-duty action movie into the VR set, let people see something that really distracts them from whatever it is that they might be experiencing?
That I've often kind of thought, I'm not too sure how many people would want to watch a horror flick or an action film.
I wouldn't want anxiety and violence going on in my head while it's going on.
There is an emotional component. If it works for them, no judgment. I will do that if it works for them, but you want to be an effective intervention. Some of the research studies did use comedy videos or TV series that were popular. The thing with watching a video is that it doesn't have any interactivity. So you're missing out on a component of the ability to interact in the environment and explore the environment or have any goals. Almost that dopamine release of cha-ching or whatever sound, bell, whistle goes off when you accomplish something that you're supposed to accomplish, within the world. So you do lose part of the component that makes virtual reality unique rather than just watching, a movie on a screen. Watching a movie within the virtual reality headset does offer the ability to block the outside visual field, so you're not seeing what's coming at you or being done around you. You don't have to see that instrument tray, but you do lose that interactivity that you get from the virtual reality environment.
Okay, and then one other thing that I thought would be an interesting application. I've run into a case where my elderly mother was not allowed to get her broken arm reset correctly because they didn't want to administer anesthesia. And I'm wondering if having this available, being able to reduce anesthesia or being able, to come up with some other form of anesthesia could allow more procedures to actually be achieved.
In her case, I'd be concerned if the surgeon wants paralysis. I would not do paralysis with virtual reality only. I wouldn't do paralysis with virtual reality, period. I would want them unconscious because even if it's just a simple, like succinylcholine, but it lasts for a few minutes, you don't want to be awake and aware and not be able to move. So a lot of times, if we can do it under just muscle relaxation, but not necessarily paralysis, a lot of times if they have bad hearts, we might use a little ketamine, in which case the virtual reality environment is not, they're not going to perceive it. But
the general concern is that you have an elderly person under anesthesia that they don't come back the same way. And so it seems like being able to reduce, do something else.
Yeah, absolutely. If I can prevent giving Versed, up front and use virtual reality instead, the Versed, before the surgery that a lot of people will give to prevent anxiety can definitely, any of those benzodiazepines definitely has a long reaching effect on our population. And that can last for months, after the procedure. So if it's something that we can use virtual reality instead to decrease anxiety, and then and not give them the Versed or the benzodiazepine, then absolutely. You also are looking at the actual surgery. So there's two separate things there. The preoperative phase, decreasing anxiety in the preoperative phase and not giving the benzos. And then the actual operative phase. Can the operation be performed safely without anesthesia or without, and we say without anesthesia, you still have spinal anesthesia, peripheral nerve blocks, their anesthesia. But can we do it without making the patient unconscious? You don't want to do a paralytic with that. So if it requires any type of paralysis, I wouldn't.
Yeah.
But it certainly can make those other options much more comfortable, reduce the amount of sedation needed if we don't need to paralyze, then absolutely. Does that answer your question?
It does. Yeah, this particular issue was one where she had a broken arm.
Yeah, so if they can reset it without paralysis, probably would still need a good propofol or ketamine to get the muscle relaxation to allow the manipulation of the arm.
Yeah.
And then in which case, that wouldn't be a virtual reality issue. Oh, Ken, I can't hear
The
you.
broken bone, the fractured arm that Bernie was talking about. Years or two ago, I broke my finger, tore like all the way over to the side, took a tumble off my bike, and when I tried to pick up off the floor, and I looked at my hand, I said, I need to do something about that. But the ER was right across the road, so that was no problem. But when I finally got in to get it set, it was completely fractured, the third, whatever you're calling it. They just gave me fentanyl.
Yeah. Well, yeah, and
I didn't mind a bit.
Yeah, it depends on where on the arm and how we're lined up with the bones and that sort of thing. Yeah, fingers, much more easy to work on than an actual arm. The muscles, they tend to want to contract, and you have to get that relaxation to move them into position. Whereas fingers, they're not so musculature. You can pop them fairly easy.
Right. I'll get the fentanyl for dessert.
Yeah. But I would say, instead of fentanyl, do a nerve block, and now you don't have, because some people You give a little bit of fentanyl and they just don't want to breathe on you. Or, you have people who, have a risk of addiction that they don't need much exposure and all of a sudden they like how they felt. And
Well, if there's no more questions, we've been going for over an hour, I think now. So I'd like to thank Tammie very much for coming. We've really enjoyed this, and you're obviously very knowledgeable in the field. Thank you.
well, thank you. I appreciate everybody for coming, and you have my email. If you want any links to something that I can help you with or get you in contact with some people that I know, be absolutely, happy to do that for you.
Thank you so much. This was awesome. Really appreciate it.
Appreciate it.
Thank you, Tammie.
Thank you.
Yep.